All right, let's go ahead and get started. Hi, everyone. I'm Karen Scoltetti. I'm the Executive Director of Openhouse, and hopefully you know what Openhouse does, but just in case you don't, or you could use a reminder, Openhouse is a nonprofit here in San Francisco that provides housing, services, and community building for LGBTQ seniors. And before I sort of jump in, I just want to give a quick disclaimer. Which is that I am not in any way replicating or trying to replace the many amazing organizations who are leading the response to the coronavirus, the CDC, the San Francisco Department of Public Health, the state of California. I'll never be a good substitute for any of those, and I will talk about their recommendations. I did want to come on today and talk about specifically thinking about seniors in our community, of course, for Openhouse, thinking specifically about LGBTQ seniors in our community as we face the coronavirus. And then I'll talk a little bit about what we're doing here at Openhouse, how we're responding at this point, and then I will open it up for questions, but you can actually ask a question at any point. For those on the Zoom call, you'll want to use the Q&A feature, which is at the bottom of the screen. And you can just put your question in there. If you go there and you see someone else has already asked a question that you also have, you can upvote the question, which will raise it up as it comes up on the screen. I'm trying to make sure I stay looking at you in the camera because I feel like I haven't gotten to see so many of you in the last week and connecting, but I have folks here to help to make sure that I hopefully answer the questions that you may have. Before I talk specifically about what we're doing and some of the recommendations that have come out, both from the city and the state and the federal level, I want to just say to everyone that this is an incredibly painful time and difficult time for those of us who have dedicated our lives to working with seniors and for seniors in our community. And the reason that it's so painful isn't just because we're scared, and a lot of us are scared. It isn't just because we're trying to figure out how to respond to something that we haven't responded to before, but it's because the messages that we're forced to send in order to try to reduce the spread of this virus are messages that sound all too familiar for older people living in our community, in our city, and in our world. So much time, virus or not, we hear community respond to people getting older by distancing themselves from seniors. We talk to seniors every day who walk through the door and talk to us about feeling isolated from their community. Openhouse at its very core, at our very core of what we do, is here to overcome those barriers. We're here because we believe that a connected community of people of all ages in the LGBTQ community makes for a stronger, a better, a richer, a happier, more fulfilled community for all of us. So nothing could be more painful for us to have recommendations that include words like distancing and telling people to isolate. Our heart breaks around that. And please know that what we are here for is not letting any recommendation get in the way of people feeling like we care about you, we love you, and we have your back. And there's never a silver lining in situations like this. I don't believe in silver lining pandemics. That seems like a bad practice. But I want to say this. I hope that if anything comes out of this experience that we learn from, I hope it's made each of us more aware of thinking about older people in our lives. I hope that if you are a person who hasn't thought about a neighbor or a person who's older than you and the ways that you may or may not be connecting to them, that this is your time to do that. And I hope that that lesson far outlives and outsurvives any experience that we have with this virus. With that, I'll turn to more of the nitty-gritty, but I just want folks to know that here at Openhouse every day since this has been unfolding, we've been talking about how do we connect our community, and we will continue to be committed to that mission. It is our work, and it is what we believe so many in our community need to be doing. So the first thing I want to say specifically about the coronavirus is that we are a small community-based nonprofit, small but mighty, community-based nonprofit. And we are not acting alone, nor should any organization in the city, and none are. We are working very, very closely with the city of San Francisco, who I think is doing an amazing job at this time. And we're working specifically with the guidance that they're receiving from the CDC. We're working closely with the San Francisco Department of Public Health, who has been heroic in leading this alongside the mayor and our supervisors and other city officials across San Francisco. We're also working closely with the Department of Adult and Aging Services, who is one of the main funders of a lot of the work that Openhouse does, but also really our partner along with almost every aging service provider in the city in providing services to seniors across San Francisco. So we are working with those folks and following their guidelines and recommendations to determine our path forward. As many of you know, those recommendations are evolving every single day. Right before we started this live stream, I understand that the president declared a national emergency. I will not be giving presidential commentary in this live stream. But even that starts to change things in terms of the recommendations that are coming out. So we're staying up to date every single day with the Department of Public Health and with the Department of Disability and Aging Services for figuring out what comes next. I highly recommend that if you are someone who is able to be online, that you actually spend time looking at the CDC website in particular, as well as the San Francisco Department of Public Health website, because both are rich with information available in multiple languages, and it allows you to see the latest updates as they come out as well. And a lot of those, thankfully, are being developed both for providers, but also for the general public and for consumers. So it's really good to sit and actually read and understand the recommendations directly from the CDC and the San Francisco Department of Public Health, rather than through alternate sources that you may not know how they've interpreted those recommendations. So the thing that is clear and has been clear very early on from the recommendations around corona is which populations are most at risk to have serious complications if they contract coronavirus. And the populations that have been defined as vulnerable are those 60 years old and older, and those with chronic medical conditions. Now, I spend a lot of time with LGBTQ seniors. They are my heroes. They are the ones who have given me so many privileges I have today. And I know that many of you are saying, Karen, the word vulnerable is my least favorite word in the world. And I hear you. I'm not a big fan of it either. I struggle with it as well. So let us not be too stubborn in our response to the word vulnerable. I'd say this for myself. And let us instead just hear those words as, if you're over a certain age or you have a chronic medical condition, you're more at risk for complications than other people. And we're wanting folks to be as aware of that as they can. Everyone else needs to be aware of that, because it's on us to step up, support each other, be there for each other in doing everything we can to reduce the chance that someone in those groups gets exposed, and that we stop the spread of this thing as quickly as we possibly can. So there's lots of very detailed recommendations around the activities, but the consistent recommendation is for folks in those vulnerable populations to stay at home as much as you can and to reduce outings except for the essential things that you're needing to do in the community. No one loves that. It's not a lot of fun for a lot of people, but that is the recommendation that's there over and over. And so we've been thinking with that recommendation in mind, with folks staying home as much as possible, what can we do to make sure that we're still connected as a community? That's what we keep coming back to over and over and over again as an organization. The nice thing is, the hard thing about Openhouse is we're a small organization, but the nice thing is we're a small organization, which means that we can be nimble and change course and take a look at what's going on and think about what's going to be best today, tomorrow, the day after, and make changes relatively quickly. So I'll just say that as we see each recommendation that comes out, we're thinking, how do we keep connected? And how do we do that in the easiest, quickest way possible every single turn as we go with this thing? I just want to say quickly before we talk about what the community activities look like, many of you feel strongly, care about, and love the staff who work here at Open House. I feel that 1,000% and more. We have the most incredible, dedicated, inspiring, hardworking staff that I could ever be lucky enough to work alongside of. And so we have been putting precautions in place for their safety, as well as, again, the general precautions around all of us minimizing close contact and staying home as much as we can to reduce the spread of coronavirus. So we've worked with all of our staff who are a part of the vulnerable groups to have them working from home or reducing the time that they're on site. We're offering additional paid time off for anyone who needs it related to the virus, and the city is also doing a lot around that hopefully folks are following. And we're working now on looking at and transitioning additional staff to be able to work from home while we remain able, nimble to connect with people. In terms of the community and where we're at, we have canceled all of our group and on-site programming through the end of March. We are providing one-to-one assistance with housing and service connection by phone. We are continuing to serve our case management clients and our residents, again, primarily through phone interventions, sorry. And we've spent this week really getting in place a system where we can start calling out to our community members to check in and see how folks are doing and let folks know we have your back, we're here, and we care. Those calls have started today and will continue to roll out next week. We also now are set up that you can call in and request either a call to help with housing or services or a call just to connect and for us to both get the experience of knowing that we're in this together by calling our main line. Lastly, we are exploring doing more of what we're doing today, which is having people join virtually or setting up phone for some of our groups. The priority at this point will be check-in calls and talking to people one-to-one because we really want to reach everyone as quick as we can, but we are starting to learn and figure out the virtual piece of what we do and what that would be like to offer in people's homes and through the internet instead. Lastly, folks who are connected to Open House, or if you're not connected to Open House and you'd like to be, one of the things that we do is both an electronic, but also a snail mail newsletter that goes out once a month. We are aware of the fact that there are people who do not have internet access, who do not have easy computer access. And so that paper newsletter for many folks is our primary way that we communicate and connect. So we are working on our April newsletter, and we plan to focus that on including a lot of information related to coronavirus, sharing the information I'm sharing today about the ability to get support over the phone for those who need it, and just continuing to make sure that people are getting information who might not be available to jump on the sort of traditional channels that are being used across the city. I do just want to say that San Francisco has also set up a text line related to coronavirus. And so if you'd like text alerts from the city, you just would text 888-777 COVID-19 SF, and then you'll receive text alerts directly from the city of San Francisco on the virus, if that's helpful. Lastly, and then I'll stop and answer questions. Some people have been reaching out to say, what can I do? And we really appreciate that and appreciate you having our back at this time. You are welcome to send us an email at info@openhousesf.org and just let us know that you're interested in helping. Please know that at this point we are organizing what the best way it would be to utilize volunteers. We're also working with our aging service providers because we need to think bigger than open house at this moment to see what's the best use of volunteers to serve seniors across San Francisco. But feel absolutely free to reach out to us, even just to let us know that you've got our back. I think that's a lot of what the community needs right now that we may be forgetting to do for each other. And then the last thing I would say is think about older people in your life and ways that you may be able to help them connect in this time, but also ways that you can help them minimize visits outside of the house, offering to go get groceries, although I'm sure everyone is having the same wonderful experience at the grocery store of it being pretty overwhelming. But again, that's a more high-risk experience for someone in a vulnerable population than someone who's not. So thinking about grocery store visits, thinking about other smaller errands that you can run, all of those kinds of things is going to be really important. But at the end of the day, the most important thing that we just want to emphasize again for everyone is, what are we doing to let seniors know you are not invisible in this time? We see you, we're here for you, we're ready to connect, and that we don't let this virus reinforce those messages that tend to exist in the world anyway. Those messages that make people feel like they don't matter, because LGBTQ seniors and seniors across this city, you matter and we're here for you. And that's what we're asking people across San Francisco to join us in saying that message. And God, if we got better at that message, we would really, we could be a really powerful city coming out of this. So with that, I'm gonna stop blathering on a little bit. And I'm just going to take a look at a couple of questions. Tom, I see, has asked a question about if regular doctor's visits not pertaining to an immediate medical need be canceled. And my recommendation would be, if you can get through, Tom, would be to call the nurse. You probably have a telephone nurse advice line connected to your health insurance. And my recommendation would be to call and ask, because they'll be able to look at the visit, where it's located, and be able to and pull up your health record to be able to better answer that question. I also see a question from Eve, who recently applied to be a friendly visitor. Yay, Eve! Thank you. Asking how you might train and activate from home. Eve, I'll make sure that our amazing staff who are running Friendly Visitor give you a call. We're not doing friendly visits to people's homes for all the obvious reasons you can imagine, but folks who are being served by our Friendly Visitor program are people who are already incredibly isolated going into coronavirus. And so we're doing a lot of additional calls to help and support those folks. And we may be able to have you help us with some of that work, Eve. And if not, we'll find another way for you to help. And shout out to Eve for being a part of Open House. So with that, if anyone else has any questions, go ahead onto the Q&A tab and let me know if you have any questions. We'll just give it a minute here. This video, just so folks know, is being this video is being recorded, so we'll be able to share it online. If you know folks who you think would be interested who weren't able to join us today, you'll be able to share it from both our Facebook page, but also we'll be able to set up a link that you can share it from as well. Okay, I see one more question that asks, why can't Open House begin to have diabetes classes and or support service in the future? My answer to that is we absolutely plan. In fact, I am standing in our almost completed new community center at 75 Laguna that we're finishing construction. And certainly as we get past this period of time where we can't offer group classes or activities here in person, we are about to be able to embark on expanding and offering a lot more classes and supports and services here. That said, please call in if there's anything we can do for you at this point. We're happy to check in and talk about other online resources, activities, classes, and most of all, we are more than happy to just call and connect. And everyone, please think about that. Who can you call in? Who can you call and connect to? I know my kids are off of school next week, and I plan to give them a long list of calls to be making out to folks. So do we have any other questions off of Facebook that I need to answer at this point? Someone's asking about the new space that I'm standing in and if it will support our Unlock partnership. Hi, Ash. And the answer is yes. We are standing in the space where the programming that we will offer in partnership with Unlock will happen. So much more to come with that. Openhouse is working on expanding our partnerships and our ability to reach people who may be disconnected right now from the community because of medical frailty, cognitive changes, other things needing more help, other things that are getting in the way of joining our things that are getting in the way other than coronavirus of attending and being a part of Openhouse. And we are really, really committed to changing that and beginning to reach everyone, including folks who are not getting to see or meet right now. So thank you. That was a great question. I'll give it another minute. So someone just asked about our Spring Fling Gala. I will let folks know that we will be sending out an official notification about Spring Fling on Monday after we do our final review with the venue and the current recommendations. But given the current situation, I will tell you that it is highly, 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 highly likely that we will be canceling the event, and we're reaching out directly to our sponsors, to the venue, to the folks who are doing the planning so that we can then communicate all of that information out to guests on Monday. But obviously, given the current recommendations, unless something were to change, we would need to cancel the event. Someone has asked, do you need more donations? I think as a nonprofit executive director, the answer to that question is always yes. Yeah, we would encourage people, if you're able to give and support our work at this time, and or if you're able to give and support to another senior organization. As I said, I'm here right now to think bigger than Openhouse. This is a really important time for you to do that. And you can go to our website to sort that out, which is www.openhousesf.org. And we can figure that out. Or you can just write the check directly to me. That's fine. No, I'm just kidding. And in terms of donations, that was financial donations. In terms of some people have been asking, are there things we can bring or deliver? I would be, we'll put out a call if that's something that we're needing at this point. We're still, again, as I said, sorting that out. It looks like that Paul, hi Paul, is asking about feeling more connected to the community by seeing and knowing who else is on the call. And I'm surprised that you can't see the other participants' names. Oh God, Paul, you're about to find out how rusty I am with my Zooming. It may be, Paul, the way that we set it up. Sorry, we're just looking to see if we can do that. Yeah, I think the way we set this one up, Paul, we're not able to do that. But we will be setting up more of these where we are able to connect people to who else is on the call. This was set up as a webinar so we could share it in multiple places at once and record so that it has all the questions on it. But our hope is to set up more of these and have participants talking as well. Anyone else who wants to ask a question before we say goodbye just for now? We will be sending you an email after the webinar today. If this was something that you found useful, I'm happy to set up more. And again, as I said, staff are also setting up opportunities for that. Oh, here comes one more question. Is Openhouse feeling okay? Are you all feeling healthy? Oh, Tom, what a sweet question. Thank you. Everyone's fine at this point, Tom. And I will just say that we have, again, encouraged anyone, even if they feel like they might be the slightest bit off, maybe not feeling well, we've been sending folks immediately home and telling them to stay home if folks aren't feeling well. So, but at this point, we haven't had staff who've needed to be out, and we're doing everything we can to take a lot of care of ourselves. We've all got rough hands from washing them so much, which is final reminder, go wash your hands after this call, everybody. All right. I think with that, we'll go ahead and end for today. I just want to say again, thank you all so much for joining us. We see you, we're here for you. Don't hesitate to call our main number, which will come to you in the email that will follow. And through that number, don't hesitate to call. Don't hesitate to say, I just want to feel connected. And we are more than happy to reach out. And even if you don't do that, we will, we're going to be reaching out to you. We know you anyway. Our main number is, here we go, 415-296-8955. 4162, Matthew, come join me for a minute. Everyone, our Director of Operations, Matthew Cimino, who has helped me not lose my mind in the last day or so, 415-296-8995. I don't get to call the main number. They just call me directly. So that's our main number. It will come to you in an email as soon as we finish this as well. It's on our website. And everyone, stay as safe as you can. We're here for you, and we will get through this. I will also just say one other final word before we get off, which is, and it's actually in response to Tom's question about if folks are feeling safe. I will just say that in the days before we stopped our group activities, and we're seeing folks more, and also in the days that have followed from our staff and others, we have had folks reporting incidents of being harassed or targeted for racial violence right here in San Francisco. And I just want to remind you that viruses do not target any particular or come from any particular racial or ethnic group. And I want to see all of us targeting our energy right now to coming together and to keeping each other safe and to recognizing the community that we're a part of in this city to try and be there together and get through this time. It's absolutely unacceptable for folks to be doing anything but. And please reach out to people in your life, be an ally, stand up, and if you see something, say something. And please let us know if that's something that anyone's experienced, and you could use a support call as well, because we are here for you. I just want to emphasize that it is not what you will hear from, unfortunately, some of our other political figures in the country, but it is absolutely what we believe and what we're here for here at Open House. So with that, thank you for being a part of our community. Everyone stay safe. We are here for you, and we look forward to connecting very soon. Thank you.